Today's speaker, as I have mentioned, is Professor Andy Barraclough. He's the Director, Training and Capacity Building of Empower School of Health. Miss Yoni Soko, she's the Rector of GCP, Ghana College of Pharmacists. And the topic for today's webinar is Career Opportunities for Pharmacists in Supply Chain and Global Health. This session will be for 1 hour, 60 minutes. This will be the agenda that we will be following up. So we will stick to the uh, time duration that is mentioned over here. There are few housekeeping announcements for participants. As you do not have a right to unmute yourself, so I would request all please turn off your videos. I would also, you can also ask your questions in the chat box after once both the speakers they completed with their presentation, and those will be addressed during the Q&A session. Please participate in the poll. We will be having two polls. Those are just a generic question about yourself to let us know basic information about the audience. The webinar recording will be available on a Power School of Health YouTube channel. The slide deck will be shared with all participants along with the link to download your certificate. And I would also request all the participants, please participate in the poll for better engagement with us. There are three housekeeping announcements for speakers. I would request, please turn on your cameras whenever you're speaking. Please mute your microphone when other speaker is speaking, and please adhere to the webinar schedule timing. The webinar objective for today's session is to deliver and explain the career opportunities for pharmacists in global health and supply chain management. Now, I would request my backing team to please launch poll 1, and I would request all participants please participate in this poll. This won't be long, hardly for a few seconds. So there are a few questions, generic questions. You just need to select the respective answers, and at the last, we will show the results to you all. Backend team, please launch the poll. I hope the poll is now visible to your screen. The first question is, what is your gender? You can select the respective one. What is your age? What geographical region are you from? If your region is not there, then you can select other. What is your academic uh, background? And how many years of experience you have? I can see 40% our audience is quite active. I can see they are promptly responding to the questions. So it's 51% now. We will be waiting for a few more seconds and then we will end this poll and move forward to the next session. %75% of participants have participated. I would request others to please also participate. Now I would request my backend team to please stop the poll and launch the results. Yeah, as you can see over here, 51% of audience is male, 49% is female. We are just 2% behind. That's okay. We will cover it in the next session. What is your age? We have maximum age group of above 30. Then what is the geographical region? Ghana. 72% are from Ghana. It's really good. 22% are from other. What is the academic background? The maximum are from pharmacy bachelor degree. Then the maximum audience have their more than 5 years of experience. Thank you for your participation. Now we will be moving forward. Before informing you all and give you little bit information about Empower School of Health, I would request Ms. Isoke to please acknowledge the audience. Ms. Mayani.
Yeah. Hello. Thank you so much for joining us today as we go through this webinar to introduce to you the collaboration that we are having, Ghana College of Pharmacists and Empower School of Health, and also look at the programs that are available under this collaboration. We'll also be discussing why it is important for us as pharmacists and pharmaceutical care providers to be interested in global health and supply chain management. And we already have more than 100 participants. We hope that more will be joining. We had quite a number registering, so as we go on, but hopefully most of us will join before we have gone through the meat of the program. And so once again, thank you for joining us. Stay to the end and remember that you will have your certificate afterwards. Thank you.
Thank you, Mrs. Soke. Now I'll just explain a little bit about Empower School of Health, and for more information, you can visit our Facebook page, you can visit our website. Yeah, so about Empower School of Health, Empower School of Health is a capacity building organization and has worked over 100 countries across multiple languages to strengthen the institutional and HR capacity of global health and humanitarian program through digital learning intervention. Our reach has already been reached out to 200,000 public health professionals globally. The focus area, we have three major focus area: leadership and change management, digital learning, public health procurement, and supply chain. As you can see on the bottom, there are 5 domain areas that we are working on: global health leadership, global health supply chain, COVID, HIV, TB, nutrition, MCH, AMR, etc., new product introduction, medical lab diagnostic training, health workforce strengthening, nurses, pharmacist care, lab technician, and supply chain. As you can see on this slide, this will show you the partnership and our reach to other organizations and associations. As we are jointly organizing this webinar in collaboration with GCP. GCP is also our partner. Recently, we have collaborated with them, and we will look forward for more activities with them. And in the same way, we also partner with other universities, associations, and organizations as well, as you can see on this slide. The advisors and faculty: Professor Paul Lalwani, he is the director in Power Group, former head of Global Fund Procurement Supply Chain Division. Professor Andy, I inform to you all, he's the speaker for today's event also. He's the director, training and capacity building. Now, I would like to give the floor to Ms. Mayani. She's a pharmacist, a pharmacologist, lawyer, a management consultant, and an educator. She's the head of agency and has responsibility for academic and administrative operations of the college and leads the execution of the mandate of the college. She is also the immediate past vice president of Pharmaceutical Society of Ghana. She leads the drive to extend pharmaceutical services in improving public health and served as a chair of disciplinary committee of the society, leading the design and rollout of training session for pharmacists. She is a fellow of Ghana College of Pharmacists, fellow of National Safety Council Ghana, member of Pharmaceutical Society of Ghana, member of International Society of Pharmacovigilance, and editor-in-chief of Ghana Safety and Health Journal. Over to you, Ms. Vianney. Thank you.
Thank you so much, Sonia. Will someone help me with the slides? The next slide, please. Thank you. So today we are going to look at career opportunities for pharmacists in supply chain and global health. And yes, my name is Yvonne Irinchiwa Esiku, and I'm rector of the Ghana College of Pharmacists. Next slide, please. This will be our outline. We'll look at, just for those of you who do not know the college very well, we will just have some information on the college. Then we will talk about the collaboration and then what we expect from this collaboration and the training sessions that this collaboration will be bringing to us. So the college. Next slide. Our mandate is in the Specialist Health Training and Plant Medicine Research Act of 2011, which is Act 833. Specifically, our information on the college in that act can be found in Part 4, Sections 84 to 113. Okay, yes. So that part of the act shows that we are a government agency. We are an agency under the Ministry of Health with objects to promote specialist training in pharmacy and related disciplines, to promote continuous professional development in pharmacy and related disciplines, promote research in pharmaceutical practice and related disciplines, and contribute to the formulation of policies in sound health and medicine and public health generally. We do this by providing training, specialized training through residency programs, and some of these engagements, as we are doing today. We also publish a journal which gives information, up-to-date information on what is happening in the pharmaceutical area in Ghana and the world at large. We contribute to formulation of policies by contributing to all the policy activities and engagements that take place in the ministry and in the nation as a whole. We also educate the public in various areas. So for instance, in quite a number of the World Health Days, we take the time to share information with the public, with pharmacists and other healthcare providers, all in a bid to promote and work towards our objects. Next slide, please. So our vision is to become a world-class college for specialized pharmacy practice for quality healthcare delivery. And our mission, next slide, please, is to develop the needed competencies for the delivery of improved pharmaceutical practice and to support effective national health policy formulation. These are the reasons we are here. Our objective, please go on, is to contribute effectively to continuous improved healthcare delivery in Ghana and beyond. And we seek to do that through training of pharmacy specialists and also specialists in other areas once they are related to the practice of pharmacy, through collaborative programs with members of the healthcare delivery team. And so we do collaborate with other colleges for the other healthcare teams, for instance, physicians and surgeons and nurses and midwives. We also collaborate with relevant stakeholders in policy formulation, implementation, and monitoring. And so we engage partners who may have similar objectives as us, and we work together to implement and monitor various activities that are aimed towards continuously improving healthcare delivery in Ghana. And we also carry out capacity building for research and information management. And these are all some of the things we do in the bid to meet our objective towards contributing effectively to continuous improved healthcare delivery in Ghana and beyond. Next slide, please. These are our core values. We think these are very important to us. They are very important to ensure that the pharmacist, the specialist pharmacist, that pharmacist who is providing the service is doing it at the top of their game. And so we consider integrity, transparency, competency, innovation, teamwork and collaboration, excellence and professionalism as critical for all our products, so to speak. All people who have gone through the college, we expect that they will show forth all of these values, and with that together, we will improve the quality of service in the country and beyond. Next slide. We do all our work through our divisions and faculties. We have 3 divisions, and each division has 2 faculties under them. The Division of Pharmaceutical Care, Drug Production and Quality Assurance, and Social and Public Health Pharmacy. All these divisions have, but that's not all that we can do. We are able under the Act to utilize or create more divisions and more faculties as we find necessary. But these divisions at this time meet our current needs with respect to the various practices in pharmacy in Ghana. Let's move on, please. Now, the collaboration, what we have been doing to bring us this program. Our next slide. Our partner in this collaboration is the Empower School of Health. The Empower School of Health is a global health academic research and consulting institute. And this institution works with a vision to empower the lives of all by promoting universal access to health and education. And so we see that Empower School of Health and Ghana College of Pharmacists have a lot of things in common. And that's why we are collaborating to ensure that we improve the capacity of the pharmacist in providing services that are necessary. Next slide, please. Now, the areas of collaboration that we are having, we are looking at capacity building, which of course is one of the reasons we are here today. But we're also looking at exploring joint collaborations with other societies and associations. I believe that the introduction that we had earlier pointed out quite a number of collaborations with other societies and associations across the globe, and we look to doing more of that together. We also want to ensure that if there are sessions that, such as this one, which will be running together, we will promote them together. And so you will see from the chat box that we have people from all over the country, because this program was promoted on the end of the Ghana College of Pharmacists, as well as on the end of the Empower School of Health. We look to executing together some webinars and training sessions similar to this. And we are hoping that in the future, we will also be doing some in-person, just so that we benefit across the practice areas and so that we see how we can utilize both in-person and online resources to the best of the use of our participants. Next slide, please. So we are looking at supply chain management within global health, of course. And of course, we'll all agree that the practice of pharmacy involves both commodities and the delivery of services. And looking at supply chain management, we want to look at managing from the raw material, whether we are looking at commodities or services, from the raw material to the end user, which is why it's important as pharmacists that we get exposed to supply chain management. We are hoping that this training, has more of us register for it, we will be looking at some of the elements, the types, the steps, and all the other things that are related to supply chain management. And with that, we will get exposure and experience to support the delivery of services as pharmacists and pharmaceutical care providers. Next slide, please. What is our expectation? Next slide. So we are, the courses, there will be more detail from Professor Andy Baraklov, and you mainly a master in science, postgraduate diploma, and diploma in global health procurement and supply chain management, and a number of certificate courses. He will take us into greater detail in his presentation. Next slide, please. We are expecting comprehensive modules for training. We're expecting that at the end of the day, pharmacists will be equipped to deliver quality health service, and also that healthcare providers who would have participated will be able to share their knowledge and improve patient outcomes as a result of having participated and gained the requisite knowledge and skills from this training. And so in conclusion, next slide. We, Ghana College of Pharmacists and Empire School of Health, are able and ready to provide the relevant training for pharmacists in global health and supply chain management. We are expecting participation from all pharmacists who are interested in managing the commodities and the resources they use and deal in. And we expect skilled pharmacists and improved quality of service delivery. Thank you.
Thank you, Ms. Mayani, for your great presentation. And I'm really hopeful that it will be a bit benefited for all of the participants, that those attended the session today. Now we will move on to next part of the session. I'm glad to introduce Professor Andy. He's the professor. I'll just give you the brief information about himself because his introduction is very long. So, he's the professor of public health and director of capacity development at the Power School of Health. Professor is one of the co-author of Yellow Book Managing Drug Supplies by MSH and WHO and Handbook of Health System in Action. He has over 30 years of experience. He has undertaken donor-funded activities in over 40 countries, from provision of family planning commodities and the response to early onset of HIV in 1990s. And now I would request Professor Andy to please take the floor and please give your knowledge to the audience. Thank you.
Greetings to all and welcome. We'll go to the next slide, please. Okay. Well, from our poll today, we see that the majority of people are from Ghana and are under 30 with a degree in pharmacy. So I'll try and focus my talk around that area. We have participants from all around the world, but I'll try and focus a little bit on Ghana. It's some years since I was working at the HIV clinic in Ho and Kofridua, but I think I can remember the region quite well, and certainly from my time at Korle-Bu and stomping around Tima medical stores. So I'll try and make it particularly relevant to the situation in Ghana today. Next slide, please. So why, as a pharmacist or as another health profession, would you consider a career in healthcare procurement and supply chain, PSM, procurement and supply chain management? One of the first reasons is already as pharmacists, you've demonstrated that you're interested in public health. And a real problem we have in public health is around 2 billion people, around 1/3 of the world, don't have access to essential medicines. Even when we've got the money, even when we've got the medicines, we're not getting them to the people who need them. So what use is supply chain if we can't get medicines to people? We really have to change and revitalize our supply chain. And if we look at why that's the situation, well, World Bank tells us it's because there aren't enough qualified logistics specialists worldwide. There's not enough in the world. And the consequences of that is not only that countries suffer health problems, but their wider economy also suffers because we're not operating supply chain well. And we need to change that. And we want people with a desire to change that situation. Next slide, please. So it's not just World Bank. We have got lots of organizations telling us there's not enough qualified supply chain staff. There are staff shortages of 30% reported, in some places 70%. We don't have staff. Well, often, in fact, we do have staff. We've taken a pharmacist out of the pharmacy and then told them, you're now in supply chain. But there's no training, there's no development, there's no instruction, and they're all at sea. Supply chain is a profession. It is a career. It requires specialist training. It required specialist training 30 years ago. It requires more specialist training now as we look at all the modern requirements of managing a multi-million-dollar operation. Next slide, please. Global Fund says the main reason we are failing to achieve the Sustainable Development Goals. What were the Millennium Development Goals? We didn't achieve them for the millennium in 2000. Now the Sustainable Development Goals, we're not achieving those either. And one of the main reasons we're not achieving them is the supply chain is not working. World Health Organization says 70% vacancy rate. But there are people in place, but there are people in place who have not been trained, who are not qualified, who are not skilled in supply chain. And Global Fund says, because it's got weak people, we've got weak supply chains, they're not delivering, we're not getting the health commodities, we're not getting the health development that we should be having. On top of this already weak operation, we've just had a 24-fold increase in the value of commodities being handled. COVID increased the volume 10 times. 10 times. We were already weak. We didn't have enough transport. We didn't have enough warehouses. 10 times. We need people who are skilled, who can manage new commodities, new requirements. And that requires a whole set of management training. Next slide, please. So why is there no human resource capacity in health supply chain? Well, there aren't many schools that teach it. There's only one school of pharmacy or nursing or medicine in the world that I know of that teaches medical supply chain, and that's in Vietnam. Because by law in Vietnam, every school of pharmacy must teach supply chain. Pharmacists cannot qualify unless they meet the basic public health procurement and supply chain management requirements. On the other side, very few schools of management that teach supply chain teach public health. In our operations, we need both sets of skills. We need the medical skill of public health. We need the management skill of logistics supply chain. And we need to find a way to join those two together. The health supply chain needs logisticians, but it needs logisticians who are knowledgeable and skilled in health procurement and supply chain. Just being a pharmacist is not enough. That is only 50% of the equation. Just being a School of Management MBA graduate is not enough. That is only 50% of the equation. We need to fit the two together so that we get people with public health and management backgrounds can put together to understand health supply chain logistics. There's a classic quote by a Minister of Health. When I put a pharmacist in the supply chain, I lose a good pharmacist and I don't get a good logistician because they're not trained in procurement and supply chain. And that's a situation we have to turn around. Next slide, please. Well, who employs these procurement and supply chain staff? And often people only think about the Ministry of Health. Well, yeah, the Ministry of Health does employ procurement and supply chain management people, but lots of other organizations do. When you're thinking about, when you're considering a career, don't just think of one channel. Think of all the different bodies that are involved in that. In Ghana, nearly all of them are active. Everyone's working there. Think about how you could consider your career, even if you start in one, moving on to others in the future. And of course, the private sector wants supply chain people as well. There are opportunities there for people who have the skills and who are qualified. But just being a pharmacist is not enough. You need to go beyond that. Just having an MBA is not enough. You need to go beyond that. Next slide, please. Well, is it really true there are jobs? Well, don't listen to a white-haired old professor wittering on. Go and check it out for yourself. Look on the UN job sites. See what jobs are there for supply chain people around the world. See if they're interesting, see if they're attractive to you. There's lots of information there. Link is on the screen. Check it out for yourself. If there are really genuine job opportunities there. Next slide, please. But there's lots of organizations. That's just the UN. These are jobs from MSH and from Comonix. Both operate in Ghana. Have a look on their website. Look at the jobs that are posted there. But these jobs are not for pharmacists. These jobs are for people who are skilled in health supply chain. That means being a pharmacist or being management trained and having public health. It needs the two together in order to access those positions. It's not just that you walk into them. The positions are there for skilled and qualified people. Check it out for yourself. Make sure what I'm telling you is really true. Next slide, please. Well, what about within Ghana itself? For those that don't want an international career, look around. Look what's there. Logistics officer at CARE, an NGO. Yeah? Even at Kolibu, we've got a job posting. Look what's there. Jobs for supply chain staff. But again, it is for people who are skilled and qualified in medical supply chain. Just being a pharmacist, not enough. Check it out. Next slide, please. There are real opportunities. The Fédération Internationale Pharmaceutique, FIP, International Federation of Pharmacists, says there are real opportunities for pharmacists in the supply chain. It wants to get more pharmacists into the medicine supply chain. We fully agree with that, but they need additional training. It requires public health staff who are trained in procurement and supply chain management, or management staff who are trained in public health. What I would say to you, at least consider it. If you look at the survey of people who are working in the supply chain, they are saying, yeah, it was a good career choice. We enjoy it. It works well for us. So there's reasonable job satisfaction there of activities because there is a huge scope. It's not limited to just the public sector, just NGOs. There's the private sector as well. There's lots of scope around supply chain. Check out the links, make sure everything I'm saying is genuine and fits your situation. Next slide, please. But here is a caution. There's a need for quality procurement and supply management training. And this is not a professor from Empower saying this. This is the NGO people that deliver. Frankly, there's a lot of rubbish out there. Those are harsh words, I know. But there are programs where particularly because of COVID, everyone believes they can now do online training. Putting 24 slides on the internet is not online training. It is 24 slides on the internet. That is not online training. Online training is an entirely different approach. It requires a comprehensive reassessment of how you do it. And if we look at the supply chain management courses that are around, and there are many available, we find that many are not adult learning. They're like school courses. Sit down, shut up, and listen to the teacher. That's not how we do adult learning. We find very generic materials, often taken from North America because it's easily available. Just copy the slides from North America. They don't apply to low and middle income countries in Africa. It's a very different situation. We see courses that lack the skills required for hands-on practice. See, many training activities not linked to the actual job function. Do you need to know about the British Constitution to be able to work in supply chain in Ghana? Well, not in the last 60 years, no. So often these courses are just not that good. So we need courses of quality training. In Power, we use two different systems, which I'll explain in more detail. Next slide, please. So we use, go back one, I'll do the ADAE there, yeah. Okay, we use the ADAE technique of developing the course material. That is, we analyze what is needed in your environment. We design the course, we develop it, we pilot it, we try it, we see what people think about it. Then we implement it and we evaluate it, and we constantly change and update our courses from that evaluation, from that feedback we see. So the starting point is ADAE. Analyze the situation. Don't take pre-recorded course material. What is the situation in the countries where you are working? We analyze it and then we design the content. We also use a system called CAT, Competency Assessment Tool. The situation there is you may already be skilled in some aspects of PSM. You may be working in procurement. You know quite a lot about procurement. You don't need to take a course in procurement. But you might say, well, I'd like to increase my warehouse or distribution skills. So you can take the competency assessment tool. You can measure how well you think you are, and it will give you a averaged assessment and comparison with other countries as well. How well are you doing? Do you need strengthening in those particular areas? So you can select which areas you feel that you need strengthening in. Okay, next slide, please. We use a blended learning technique. Face-to-face learning in country, web-based learning, of course, that's the big part. Micro-learning, little messages to mobile phones, little pieces, little bits. Virtual labs, where you can do what-ifs. What if I change the distribution system from centre, instead of going to province or state, then down to district, I just went centre to district. What would happen? What's the effect of that? I can do little tests like that called virtual labs, where I have a look and do all those what-if scenarios. Adaptive assessments, how well are you proceeding? Do you need more in a certain area or less in a certain area? And gamification, playing games to learn about the system. As an old man, I had to learn that people learn through playing games. Yes, they do. They play it online with that, and by looking at playing the game of how do we stock the warehouse, we learn about the effects of different parameters on the warehouse. The overall message is online learning is not just a few slides on the internet. It is supported, multifaceted, blended learning, pulling this together. We're not the only institution that does it, but you need to select a course that uses that technique. Next slide, please. Is the course certified? Well, we have certification from ASIC, which is the UK accreditation body, ISO, of course, and Kent State University for the postgraduate diploma, and now with UNITAR, the United Nations Institute for Training and Research, for the master's degree course. So you can be sure of a genuine course. Whichever courses you're looking at, look at the accreditations, look at the certifications for the course. Next slide, please. Back one, please. Yeah, okay. So overall, PSM, for me, has been an exciting and challenging area. I believe there are real opportunities, but understand those opportunities are only for people who are skilled and qualified. The COVID pandemic has highlighted as never before the acute need for skilled and knowledgeable healthcare PSM staff. Really brought it to the fore, and now is the time to lever that while it's being recognized what's required. Okay, next slide, and I think over to you, Sonia.
Thank you, Professor Andy, for your presentation. So now this slide will show you all the courses that Professor Andy was talking about, the Empower, our courses that has been launched by Empower School of Health. So we recently launched Master's course. We have two categories in Master's, and this has been launched in two languages, that is in English and French. So, and this course is certified by UNITA. Postgraduate diploma, this is a one-year course. And obviously, this is also in two languages, English and French. Then diploma for 6 months, English and French. And there are multiples of other short-term courses. Those can be from 2 months to 1 month. And for more information on the courses, I would request you all to please visit the website that will be posted on the chat box. Please visit this link for more information. These are a few other courses. Some of them are, for now, they are in English language, but most of them are in both English and French. So I'll give you more information about the master's course. As mentioned, the master's, we have two categories under master's, MSc to 24-month course. The fee for this course is 8,000 USD. And this is the initial fee, basically. There we also have a partial scholarship options available with us. And the second category is 12-month MSc course. This is specifically designed for PGD graduates from Empower School of Health. And the third course, that is the PGD 12-month, the fee is 2,500 USD. For any information related to the courses and for knowing about the partial scholarship and the fee structure we have, please get connected with us. The email ID, which is mentioned over there for scholarship, for enrollments, and for fee-related questions, you can drop an email to the operations at Empower School of Health and info@empowerswiss.org. And for the detail of the course, the link is mentioned below. You don't need to worry about it. The slide deck will be shared with you all for your future references. Now, this is the time for poll 2. And before that, I would request you all, first of all, both the speakers for their wonderful presentation and the participants for their participation. Please be ready with your questions. After this poll, there will be a Q&A session. So you can put your questions on the chat box, or you can raise your hand if you would like to speak to a specific speaker. And accordingly, the floor will be given to you. But before that, please do not forget to participate in the poll 2. I would request my backend team to please launch poll 2. And this will help us to improve in the next session, upcoming session. So the first question is, what percentage of information was new to you? So you can accordingly select your answer. After this webinar, would you like to enroll in the courses offered by us? How did the session compare to your expectations? How likely are you recommended this session to a colleague or to your friends? So I can see the people are increasing. Please participate. As of now, only 10% of the participants have participated. It's keep increasing. So we will wait for a few more seconds. Thank you. Still, half of the audience are still awaited for their answers. Kindly participate in this poll also, and then we will move forward for the Q&A session. On the first question, I can see the people, what percentage of information was new to you? So 50 to 75% says, the most of 68% people says between 50 to 75%, 13% says 100%. Still have 35% participants to participate in this poll. I would request you all to please participate. The second question, after this webinar, would you like to enroll? I can see maximum 77% says yes. Okay, there are no, 7% says no. We really would like to know the reasons. If you can, how did the session compare to your expectation? 45% says excellent, 46% says good, and 9% says fair. So still there is a scope for improvement, I would say. How likely are you recommend this session to a colleague? 8 to 10. Maximum percentage says between 8 to 10. Thank you so much for your participants. Now I would request my backend team to please stop the poll. Now we will be moving forward to Q&A session. Professor Andy and Ms. Bayani, I would ask you, please have a look on the chat. If you think the question is appropriate for you, I would request you to please take that question.
Okay, if I start perhaps, and then perhaps Yvonne can join me. Okay. Okay, Benedict, so you say you have a D.Pharm and an MBA. You should be applying for a senior position with the United Nations or with one of the major NGOs like MSH or Comonix. Frankly, you don't need us. You can just go ahead and go and get the job. We'll be happy to have you for supply chain training, but with those kinds of qualifications, the world is your oyster. Go and get it. Yvonne, how do you feel about it?
I feel the same. Great, great qualifications, ready for the job market already.
Okay. Joseph, you're asking, do we track the graduates? We can't get rid of them. We have them on expert sessions and webinars every month. And most of our expert sessions are run by our former graduates. So yes, they are doing well. Not everyone is doing well. Not everyone graduates. But generally speaking, they don't have a problem on the employment front. They might not get always the job they want, but they're getting jobs there. Okay. Christian, you asked about the combination of a B.Pharm with SIPS. SIPS is a good course, but it is not specific for healthcare logistics. It's very good, lots of good background information on the SIPS course, but if you're in healthcare, you're going to have to learn to adopt a lot of it to the situation you're working in. Yvonne, I don't know what your experience of SIPS is, perhaps.
I don't have that much experience in it, except that I know it's a program that's available. And so I really cannot comment on the content of the training.
Okay, it's good training, but I would say it's not specific for healthcare. Okay, Ernest, you've raised your hand. Would you like to unmute, please, and ask the question? Ernest, if you want to unmute and ask the question.
Ernest, if you can hear, please unmute and ask your question. I think perhaps Ernest cannot hear us at all.
Okay, then no problem. We go to other questions. Are there universities that offer scholarships for PSM, especially for those of us without business backgrounds? The simple answer is yes. If you want healthcare PSM, there's a number of universities. Cardiff University in the UK is one of them. There are 3 or 4 in the USA who do it so as well, but you would need some background, either business or public health. You can't enter this without one or the other. Okay.
Yeah.
Okay, Salom, is the course going to be online or in person? Course is online with local content in person. I was selected by Empower, but when I asked for invoice, couldn't get it. I'll pass that one to Sonia to speak with you directly, to communicate with you and see what the problem on that is. Anyone else would like to ask a question, please raise your hand using the little icon at the bottom of the screen and unmute and speak.
I think there is a question on whether there are PhD programs, but I think at this time, what we are talking about is a master's program, not PhD.
Right. We are currently not offering a PhD program. We are looking at it, we are considering it, but it takes a long time to get these programs accredited. We wrote to the master's degree program 4 years ago. It's only in the last 6 months it's been accredited. We've spent that long trying to go through the accreditation agencies to get it done. It really has been a bottleneck for us. PhD, we're looking at it, it's not there yet, and I can't think it's going to be there very soon. Thelma, if you'd like to unmute and ask a question, please.
Yes, good day to all. An excellent presentation, Prof. I'd like to find out the course, is it a part-time course or it's a full-time?
We let you decide on that. It requires about 40 hours per month of study. If you can do that part-time, that's fine. And we thoroughly encourage that to happen. But that's the basic requirement for both the postgraduate diploma and for the master's degree, about 40 hours per month of study time. That would mean basically you can do it at weekends. You can do it part-time if you have a regular job, and the majority of our people are already in jobs doing the course. Okay.
Someone is asking about any consideration of scholarship for candidates who are working in your donor agencies like Local Fund?
Right.
Yeah, go ahead, please.
Okay. MSH, Chemonics are both sponsored staff. UNDP have sponsored staff, provided scholarships for staff to undertake the course. Global Fund rarely will do that, but that's because they're not being asked. If we look at the Global Fund grant applications, less than 5% contain any request for PSM training. If countries would include PSM training in their Global Fund grant requests, they would get the money. Global Fund wants PSM training, but countries have to request it. So it's a major point to get involved in your Global Fund program and get them to request funding for training, and then you can get it. We have, I think, only 2 ever from Global Fund sponsorship, but Global Fund will sponsor it. They're not getting asked. It's not happening. Do you provide courses based on regulatory bodies? Specifically for NMRA, no, but I believe anyone in the NMRA would benefit from our course, particularly the quality assurance element of the course is especially relevant for National Medicine Regulatory Authority staff. But there are also WHO courses for National Medicine Regulatory Authority staff. They are exceedingly intense. So what I would suggest is do a general PSM course first and then consider one of the WHO specialist courses, for example, in good manufacturing practice and premise inspection and certification. I don't know, Yvonne, if you have an experience of any specific NMRA training courses.
No, not. We do expose our candidates to a few of them, but not as a replacement for other training sessions, as an add-on, just as you have mentioned. Yeah. Someone is asking if it is possible to finish in a shorter time, so 18 months instead of 24, if they have the time.
If you pass the sessions, yes, the answer is yes. Generally, we don't allow less than 18 months for the master's course because we think you can't do it in less than that. But yes, you can. You don't have to go the full 24 months. You can do it in less if you pass all the sessions, and there's quizzes after each chapter, and there's major study sessions after each module. But if you can do that, yes, you can.
Great. Someone is also asking about the recording. Yes, the recording will be made available afterwards. So yes, if you joined late, you can still get all the information that was shared.
Good. Again, a PhD course. No, we don't have a PhD course at present. Scholarships, we did talk about partial scholarships available and full scholarships. We would like to get more. We are regularly pleading with UN and donor agencies for scholarships, but the response that comes to us all the time is countries aren't asking for them. This is what we get all the time. We are asking them for the students, but they're saying countries aren't asking for them. So you need to be getting hold of your country to get them to ask for these scholarships. I have MSc in pharmaceutical management. Can I start to study postgraduate or master's? If you're doing the master's course without having completed the postgraduate diploma, it's a 24-month course. It's a 2-year course. The simple answer to your question is no. You have to go through the whole course. It's not about pharmacy. It's about logistics management.
Yeah.
What is UNITAR syllabus course in MSc course? The course is, the master's degree course is jointly developed and certified by Empower and UNITAR. It's a single course. It's not 2 parts, it's done together. So you get a joint Empower UNITAR qualification. So UNITAR is registered with the United Nations, as you might expect, as a university body. Empower School of Health is registered with UN and the UK Accreditation Agency.
I believe Vishnu is asking, I don't know if it is complete, says due to an unavoidable, I have registered for PGD PSM.
Yep.
Due to an unavoidable situation, I could not complete my task. I suppose he wants to know what the next step should be.
Get in touch with us. We will see what can be done. We're always open. Don't be afraid to contact us, email us, speak with Priya, who is our main contact person. Just send us the email. We'll see what can be done. We'll explain what the options and the possibilities are. We don't want to exclude people. Equally, we cannot allow everyone in. Okay, but speak to us, give us a try, see what we can do for you.
And yes, there's a question about a certificate for today's session. Yes, there is.
There is a certificate for today's session, yeah. Okay, I see we're on time at 18:30.
Yeah.
Yeah, so yeah. I guess we've got to hand back to Sonia to finish up.
Thank you, Professor Andy. Thank you, Anne. And thank you for all participants for your participation. As mentioned, the certificate will be provided to you all. The recordings will be provided to you all. And this slide deck will also be shared with you all. For any course-related questions, for any enrollment-related questions, fee-related questions, please get connected on the email ID that is mentioned on the chat. And for any for further session, please visit our Facebook page. Everything will be posted over there for all the upcoming sessions. Thank you so much, Ms. Yoni, for your presence, and GCP specifically for your, for your assistance and for your all the necessary arrangements which you can do. Thank you so much.
Thank you. And just to say thank you to everybody for participating. We at some point had just under 240, which is great. And we hope once, as we are going to share the video, we will get more people getting to know about these courses. And of course, from the chat and the interaction, there are lots of us who are interested in these programs. And so I'm sure we'll be seeing a lot of registration for various levels of the courses. And yes, if you have any specific issues that have not been addressed, contact the institution and with the address that has been given, and you will get the response. It is possible that there is something you've done which will maybe exempt you from some courses and allow you to go ahead and finish the program. Thank you very much for joining. And yeah, we look forward to great success in the future. Thank you.
Stay. Goodbye.